This video is talking about left versus right brain thinking. So what does this mean? So the left brain is usually in charge of analysis and mathematical deduction. The right brain is more synthetic. Synthetic means cohesive, seeing things in a large picture. It's more artistic. And so what I find, which is very interesting, is that in particular women, when they come to see me, are here for left brain problems. And what I try to do is convince them, and all patients, to be honest with you, to look at right brain problems. Because the whole reason to have a procedure done with me is to solve right brain issues. So let's talk about this so you understand this better. So what do I get when patients come to complain about things that they want to have fixed? So when I listen during a consultation, which of course the first part of a consultation is hearing what bothers you. Usually it's asymmetry. Usually it's this little crease makes me look older, or this doesn't look good, or that little dot over there is not right. My eyebrows are not the same height. And that's really what I want fixed. The problem is the left brain problems, first of all, are things that are really not fixable in certain regards, and they're really not worth fixing. So I always say the two sides are not the same and can never be made the same. So symmetry is overrated. I have this thing that I show my patients. I think the most beautiful people in the world are actually, when I show them when their face is symmetrically recreated, they don't look any better. In fact, they look weird and robotic. So symmetry is overrated, and the fact that when I say the two sides are not the same and can never be made the same is very important. So of course there's deformities where someone is really lopsided, they have a facial paralysis, or they've got a deformed lip that's hanging down. But asymmetry is really something that I try to get patients out of their mind so they don't think about it. A right brain issue is when I look at the face and I just feel like, wow, that person looks so much better. And that's the reason to do this. When you look at my before and afters, when you judge, is it worth what I've done? You have to use your right brain, which is, does they look better? Because when you pick it apart, and any procedure that I've done, you'll say, well, the jowl is just not quite perfectly smooth, or my God, I did a fat graft, but I still see a little hollowness under the eyes, or the nostril, there's still a little deviation. It didn't quite fix the nose perfectly straight. I like what a colleague of mine said, always improved, never perfect. And that's important because we think that, hey, I'm not a perfectionist, Dr. Lamb. I'm not asking for perfection. I just want a little bit straighter and more symmetric. I've noticed that whenever someone comes in with a left brain problem, they actually are never happy, because women in particular, they put makeup on, so they're using 8x, 10x magnification. They're super close to the mirror. They're looking super close and wondering why this area bothers them. It's a microscopic evaluation of the face where no one can tell the difference. So the problem is it doesn't really make you look better if I manage one wrinkle on this side or one little black spot. And it's not fixable. I can't get rid of it. So I'm sitting here trying to fix things microscopically and I can't get it better. I'm more right brain. Now I'm very technically a precise surgeon and injector, but I am inherently more right brain. I did a test. I'm actually 60% right, 40% left. And so for my accountants out there, my analysts out there that are very left brain inherently, it's hard for them to shift gears to use their right brain. But it boils down also, why would right brain be so important? The reason a right brain approach is so important is, why do you want to do this? What is the why? The what is, okay, a facelift. A what is eye bag removal. A what is rhinoplasty. A what is Botox to manage some wrinkles. Why do you want to do it? Why do you want fewer wrinkles? Why do you want your neck lifted? Why do you want fillers in your lips? The reason is to look more attractive, to look better, to be more, to have more confidence, to look better integrated socially, professionally. That's a right brain thing. So when you look at my before and afters, if you judge it with the left brain, all of my results will fail you. But if I look at my before and afters, I believe all of them will win from a right brain perspective. And you have to use your right brain when you're looking at my before and afters. And you also have to use your right brain to understand why you bother to do this. I'm an artist. I paint every single day, almost 7 days a week, sometimes twice, 3 times a day, but usually that's on the weekends. On the weekdays, I paint every morning. I get up in the morning. I work out from 5 to 5:30. I paint from 5:30 to 6:30. Then I go to work and do my surgeries. I'm very right brain. I look at the world in color and line and design. And it's very hard as an artist to convey those issues to you. But if I don't convey those issues to you, you won't be happy with me at the end. I always like to say the difference between an education and an excuse. An education I tell you before, excuses afterwards. And I love a lot of education. So I need to retool your thinking, especially if you're coming to me for a consultation. And every single one of my consultations, I try to encourage and focus on right brain thinking. So a great example, I had a lady that came in from Austin last week, and she goes, I wonder why my lips always fail. I'm never happy with my lips. And here's a woman that came into me with overdone lips, and I actually had to dissolve them. I had to get rid of that weird look. The reason is, I said, I know why your lips have failed every time. And without her even telling me why she thought her lips failed, and she may not even seen that the lips still look fake, but the reason why is, I told her, I bet the reason you went to your doctor is you put some on your left side and you thought, well, it's not quite balanced to the right. I've got to put a little bit more on my right. And then this side is not quite the same height as this one, so I've got to go put some in. And guess what? When symmetry is one of the desires, you're never happy. Even if you're not a perfectionist, you're going to go back and say, well, I just need a little bit more here, doc. I mean, I'm not being a perfectionist. It's pretty good. You did a pretty good job, but I wish a little bit more. And guess what that led to for her? A dissatisfied patient with an overdone fake-looking lip. Now, I'm not going to give that to you because I don't offer my patients the option to look fake, and that's another whole video I'm going to talk about, which is the standard of fake, which is your standard of fake is actually much lower than mine. But what's even as important to me is to understand when you pursue left brain desires, you achieve nothing. You're not happy at the end because you don't look any better. So a great example is a lady that I did meso-Botox for, which you've heard some videos. I shot a recent 25-minute video on this, but I got her texture looking great. And I asked her, she's 41 years old, beautiful lady, patient of mine for maybe 12, 14 years. And I said, hey, are you happy with my meso-Botox? Or did you see a difference? Actually, I asked her, do you see a difference? And she says, no, I didn't see a difference, but I've had 5 compliments on how great my skin looks. Well, wait a second. How does this woman who knows her face really, really well not see a difference? But she's gotten 5 compliments from people. The reason, again, is left versus right brain. She's analyzing, well, all the dots didn't go away. I didn't get the pores Dr. Lam was promised. And she wasn't unhappy at all. It's just that she sees herself close up, and every little microscopic flaw never got better because it won't. It's not all going to go away. But 5 people looked at her and said, God, she looks really good. The collagen is reshaping. I mean, they're not saying that, obviously. They don't know what it is. It looks like I've lasered her because the pores are better. Not every pore, because if every pore was better, she would be happy. Or she would see the difference, so to speak. Again, she was happy. She just didn't see the difference. But 5 people looked at her, felt something about her looks great because I've gotten a confluence of pores, texture, tone, maybe some mild discoloration, quality of skin, facial shape, all better. And that composite of all those areas made someone else feel that she looks better. And that is from 5 feet away. So the judgment of left and right brain also has a lot to do with distance. As I said, I'm not trying to pick on women because the majority of my patients are women. So I have to understand women, and I have to understand what makes them happy. And I have to understand what makes them not happy with my work. And I rather than be knowing what's going to make them unhappy before I do the work than afterwards, for the reasons I've enumerated. That I always like to give a lot of education about the limitations rather than an excuse, because if I say the same words out of my mouth after the procedure, Dr. Lam, no, you're just making excuses for yourself. This is not what I wanted. But it's really that judgment there. So it's distance. So women are this close to the face to make sure to see if they like it. And you need to be that far away or this far away or this far away. I can't even be in the video framework, because if you're far enough away, you will look at it and feel something's better. So I always tell my patients, your instinctual feeling is how I want to improve it. But if you stare closely, so well, wait, Dr. Lam, at 5 feet, I still see this flaw. And the reason why is that you have stared at it close up, and therefore you can't get it out of your head. It's sort of if I say, hey, don't think of a pink elephant right now. Well, the first thing in your mind is a pink elephant. So if you tell your friend or your spouse, hey, you know what? I really wish do you see this line? At first he's going to say, no, I don't. But guess what? Every time he walks by you, he's going to see that line, because now you've created this impression that there is the line there, and then he's going to look for it. So every time you walk by a mirror, you're looking for something that you think is there, and you're staring to see it. And so if something is not there, and I'll guide you on this, and I divide my work into what I call green light, yellow light, and red light. So green light means please consider it because it's really worth the money, and it's how I would target to make you look better. A yellow light means, it's not going to hurt you. It'll give you some benefit, but to me, it's really a waste of money. It's not going to do too much. I will do a yellow light for you. It's not what I prefer, but if that's what you want, you have disposable income, I can do it, and you know the limitations. I really prefer you do green lights. If you do some green, you want some yellows to make you happy, great. A red light means no, you're going to look absolutely ridiculous, and I'm not going to do it for you. It's not right. For example, anterior cheeks. It's another video I'm going to talk about why I don't do anterior cheeks. But this is the idea, is that that's a no-fly zone. I had a lady just yesterday, a lady with me 15 years, a really sweet woman, drives from very, very far away. And she said, hey, Dr. Lamb, can you put some volume in my cheeks? And she actually has pretty full cheeks. It's just the nature of how she is. But even half a syringe would have made her look weird. And she's totally sunken on the side. Her jawline is absent down here. And she's aged some since I've seen her in the zone. So I said, no, I'm going to put 4 syringes in here to rebalance her face and to make it look more aesthetically more attractive. And so that is a concept that is based on right brain decisions. I make my choice and decision to help guide you what you would want with my right brain. I immediately look and go, your neck is sagging, that's the problem. That's what makes you look unattractive. If you're not ready for a facelift, don't do it. But I'm going to guide you and say, look, your number one problem is your eye bags. And I'm very blunt. I had a lady recently that told me, Dr. Lamb, I send you a ton of patients. But last week I had a patient that I sent you who was very unhappy with you. And I said, I think I know who it is. It's a lady that came in for consultation. She walked out of my consultation because she came in wanting to do fat graft into her eyes, and she would benefit from it, but her lips looked artificial, and I feel I have an obligation at least to tell you. I can't tie you down, although sometimes I do want to do that, and dissolve your lips, but I need to tell her lips don't look natural. But if I don't say that, I think it's a problem. I think I need to give you a very honest appraisal. You're not here to be my friend. I'm here to be your plastic surgeon, your cosmetic injector. I'm here to help you look better. And honesty is the very first thing I tell you. If something doesn't look right, I'm going to tell you this. And I'm going to do a whole video about standards of naturalness coming up in a moment. But this is how I'm doing intermittent fasting. So my lunch hours are really for me to talk to you as a prospective patient. And I like the fact that unlike Instagram, where I've got to be confined to a 30-second, 1-minute video, which I've done a lot of those, and I continue to do them because I think a lot of us have very short attention spans. We want to hear exactly, get to the point, Dr. Lamb, be fast. I can do that. I can speak very quickly and get to the point. But this is like one of my consults where I will tell you all these things. And the more of these videos you watch before coming to see me, the easier it is for you to really understand all my philosophy. And so this concept of left and right brain is so important. When you come to me, I want to hear what bothers you, okay? If a fine line near your mouth bothers you, sometimes it is a problem. Sometimes it really does make you look older and not as attractive. But sometimes it's just overblown. And I'm not going to just dismiss it in the sense that, hey, you're crazy. But I will tell you, look, hey, this is not necessarily where I would start. It's not where your problem is. Because you said, well, Dr. Lamb, look, if you're treating people with disposable income, they can throw money anywhere they want, and why don't you just do it for them and just be blinded to the idea that that's where they want? If I go into a store at Neiman Marcus and I want a pink, boa feathered jacket, and that's what my taste is, why can't you just do it and shut up, right? And I think part of the reason is I'm an artist, and so I don't like wasting people's money. Now, as I told you, if that category is a yellow light thing where I think it's not really going to do a lot of, good for you, like let's say it's a fine line, and I can do that for you. I would rather at least tell you after answering what bothers you, because I will do that first. I'll say, look, if this is what bothers you, I'll tell you what this is. But then I'll give you my philosophy about left and right brain. I'll tell you these are the things that really would benefit you the most. Now, if you said, look, I don't want to do that, not interested in eye bag removal, I'm just interested in some fillers in my folds, I can do that. But ultimately, if it doesn't make you look any better, you have to understand that may be a waste of money, and that's okay. You can waste your money. The only thing you're not allowed to do with me is to do something dangerous or stupid. That makes you look worse. And a lot of people say, hey, Dr. Lamb, the reason you're like that is that you just don't want your reputation to be sullied. And honestly, it's not the reputation. Of course, it's part of it. But honestly, as an artist, I just don't do things I don't want to do. I don't come here and do things that are stupid. That I get up in the morning because I love what I do. And ultimately, I want to do something that looks really, really beautiful for you. Okay, hopefully that makes sense to you. So I know I've gone on and on for about 15 minutes on this topic, but I hope it has some resonance for you, frames your brain, helps you look at my before and afters in a certain way, and understands my philosophy of who I am when you choose me as your surgeon.